A parade of the powerful, Prime Minister, senior cabinet ministers and the highest official in the land, all influencing our lives, but all finding a shadow over theirs. A political shelling of the Prime Minister and Health Secretary, relative silence from Dominic Cummings about his oldest ally, lavish praise for the next generation, and for the new Cabinet Secretary a reminder, I was instrumental in your appointment. Out of exile for the day, and a canny knack to unsettle with criticism or praise.
Careful, careful, careful. He has an impact partly because everybody's talking about what he's saying, who he's giving points to, who's clearly in the Cummings camp, who clearly isn't in the Cummings camp. So in that sense, what's really interesting is, does that have any impact inside government? Lots of people are commenting on the fact that Michael Gove barely rated a mention. Rishi Sunak was singled out for praise. Is that good for them, or is that a sort of mark of suspicion? And so I think the question is this really destabilising to those relationships, the people who've stayed inside government as well as the people who've left?
The day after, and a cabinet fight back, though words were chosen with care. Wouldn't want to provoke the volcano.
I think that it's important for us to focus on what really matters to the people of this country. And I think, if I may say so, that some of the commentary I've heard doesn't bear any relation to reality, and what people want us to get on with is delivering the roadmap.
Thank you, Mr. Offered a chance to say whether Matt Hancock is the right person for the job, the Prime Minister demurred. The Health Secretary, who faces serious questions over allegations that he lied, denies the charge. He's fighting his corner.
I welcome the opportunity to come to the House to put formally on the record that these unsubstantiated allegations around honesty are not true, and that I've been straight with people, in public and in private, throughout.
Not the most clubbable of ministers, but help was at hand. A busy morning for the whips, although there is genuine anger too.
Is not the greater irony, the strange epiphany in many who have gone from regarding the Prime Minister's former advisor as a latter-day King Herod, whose words and deeds could not be trusted, into a prophet who, fresh from the wilderness, brings with him supposed truths written on tablets of stone. Mr. Speaker, irony of ironies, all is irony.
What do we know about the Secretary of State? Well, we know he's exceptionally hard-working, that every day he woke up to try and save lives.
The shelling of this building was intense, and the defences are now in place. Dominic Cummings clearly has the power to disrupt, but there's growing confidence here that his ability to wound, let alone score, a fatal political blow may not be as great as he'd hoped.
His credibility is undermined, first by the fact that, he went to Bernard Castle and that caused chaos. Secondly, by the fact that, he's no longer there and he's picking a fight with his ex-colleagues. And thirdly, the credibility is undermined by the fact that he seems to have friends of Dom and non-friends of Dom. And look, Boris is looking powerful at the moment. He's come through, he might have lost a few battles, but he's come through the war looking strong. The vaccine is going really, really well. So we still have a strong Prime Minister.
Battening down the hatches now that a one-time insider is on the loose. Dangers lurk for some, but for the moment, this looks survivable for the Prime Minister.
Joining me now, Rory Stewart, former Conservative International Development Secretary who lost out on the Tory leadership to Boris Johnson in 2019, Simon Hoare, Conservative MP and Chair of the Northern Ireland Select Committee, and Stephen Reicher, Professor of Social Psychology at St Andrews University and member of the Independent Scientific Pandemic Insights Group on Behaviours, which advises SAGE. Rory Stewart, if I could start with you. You and Dominic Cummings go way back to when he supported you being kicked out of the parliamentary Tory party by text message after voting against the government on Brexit. Is he worth believing from your point of view?
So I find myself in a pretty contradictory situation. On the one hand, as you say, Dominic Cummings set out to throw out me and 21 others who tried to go against a no-deal Brexit. On the other hand, I do recognise very much a lot of what he's saying in terms of real problems in crisis management in government. I saw it when I was a flooding minister. I saw it when I was the International Development Secretary dealing with Ebola. and I sensed it very strongly in the COVID response. The British government is not well set up to deal with emergencies and crises. Something in our political culture tends to leave us to avoid hard decisions, kick things down the road, and that's very, very dangerous in an emergency.
But isn't that where leadership comes in? Because are you talking about the systems? That's the part that you agree with. He also said the Prime Minister wasn't fit for office.
Well, there again, I agree with him. I mean, I ran against Boris Johnson because I thought he shouldn't be Prime Minister, so you're not going to find me disagreeing with him strongly on that.
And yet, but the recent results show the public.
Boris Johnson's got certain kinds of strengths, but mastering detail, taking rapid decisions are not among them.
Well,
and what worried me from the beginning of the COVID response was that I sensed that in order to deal with a government system, which very understandably civil servants will tend to ask for more information, want more time, you need a different style of leadership. You need politicians who are prepared to ask very basic questions like, why are we doing things differently from East Asia? Is the NHS going to be able to cope with this number of cases? And what happens if we get a vaccine by the end of the year? And those questions were not being asked.
According to what we've heard from Dominic Cummings. Simon, if I come to you, one of the very few Conservative MPs who called publicly for Dominic Cummings to go after that trip to Barnard Castle, you were calling him cavalier, and yet we now hear from him he claims to be a greater supporter of swifter lockdown than the Prime Minister.
I think Mr Cummings has got a huge credibility problem. He behaved very badly over Barnard Castle and brought damage to the government as a result of that, and very bravely, for reasons I still never could quite understand, the Prime Minister decided to stand by him and to support his man. I think Cummings has behaved appallingly. If all of this weakness was in place. Now, I agree with Rory. If we have to learn anything from this pandemic, it's that the machinery of government needs to be swifter in responding. But is Cummings really trying to dupe us to believe that he sat at the very heart of number 10, saw supposedly all this chaos and weakness and lying and everything else, didn't breathe a word of it, didn't blow the whistle, didn't resign? No, he sat there, it was the heart of it, and kept banking the cheque. It is implausible beyond belief. This time last year, we were all calling him Machiavelli. This year, he wants us to think of him as St. Augustine. It really doesn't work.
But sorry, just to talk about what you mentioned the word duping there. There are many people who feel, especially in light of what Robert Jenrick, the Community Secretary, had to say this morning, a member of the Cabinet, that the public were being actively duped at the beginning of the pandemic with things like promises like there was a protective shield around care homes. And people could see with their own eyes, with what was happening with their own relatives, that that was not the case. Promises of tests that were not happening. So you talk about duping, but there are things in that testimony that people know to be the case.
Well, Mr Cummings was telling us that he thought that there were things being said around about this time last year and immediately thereafter, which he knew to be untrue. If we're to take him, what he wants to do is some sort of prophet of honesty, why didn't he speak up? Why didn't he resign? I think it's all pretty far-fetched. I think the key thing to remember here is that all of this, who would have been a senior minister in any government, in any country, dealing with this size and scale of swift-moving pandemic? There is no book to take off the shelf. Let's look at chapter 4, what to do in week 3.
Sorry, but there were other sorry, I have to interrupt at this point. There were other countries that didn't need to wait for vaccines to save people's lives. And it's all very well that you do not believe Dominic Cummings because you don't believe his character, but addressing those issues are key, and people do not feel that the government have gone far enough with that.
Well, the point I was going to go on to make is there's clearly going to be a future role for an organisation, let's say, for example, the World Health Organization, to better coordinate an international response to this. Each country was left finding its own way, trying out its own ideas, exercising its own judgments in the absolute hope that what it was doing or what they were doing was right and would have some effect.
Yes, and we're being led by a country.
That is why we have to have that inquiry. So all the key learnings, both the good things and the mistakes, can be picked up. But crucially, and going back to the point that Cummings was making yesterday, and that Rory's alluded to a moment or so ago, we will need to, Whitehall will need to look at, Westminster will look at how best it can get itself into shape.
But it's not. I have to bring in our other guest here. I have to bring in Stephen Reicher. But it's the point about, it's not just about World Health Organization coordinating a global response in the event of future pandemics. It's about who we've elected and who he then appoints that isn't elected to advise him, who then tells us what's been going on from his vantage point and taking responsibility, I suppose. But that's where the inquiry comes in. I do need to bring in Stephen Reicher. Simon, let me bring in Stephen Reicher. Dominic Cummings called into question the credibility of behavioural scientists, your profession, yesterday. Did the advice of your colleagues put off the Prime Minister from locking down sooner?
Well, I always thought that House of Cards was fiction. I've been learning a lot over the last 24 hours. I think it's really important to make a distinction. When it comes to policy, what Dominic Cummings did in his evidence was to corroborate from the inside what we already knew from the outside. And we knew we locked down too late. We knew that we were too slow to form a decent test and trace system. And even when we did, we didn't do it very well and centralised it when it should have been based on local public health. We know we didn't control the borders. We know we didn't support people for self-isolation. All these issues we know, they're still problems, many of them. And it was useful to have an inside vision of how that happened. However, when you move from policy to personality, about who said what to whom, we simply cannot know. It's one person's word against another. And I think one of the things that I think we discovered over the last 24 hours is how eager people are to understand why things went wrong. And undoubtedly they went wrong. We have the worst death rate in the world. The only question is why. And that should be being addressed through a public inquiry. Then, instead of people making accusations without evidence, with parliamentary privilege or with the right to say what they like, we would have people having to supply evidence. We would have people under oath. We would have people cross-examined, and we could get to the root of these really important questions.
But you sound
what was happening yesterday should have been a proper public inquiry, not an embittered ex-civil servant striking back at those people.
But hang on, just one moment. The question I asked you was about the issue around who was influencing the Prime Minister about locking down. And you sound like you believe Rory Stewart you sound like you believe Dominic Cummings. I'm coming back to Rory Stewart in a minute. You sound like you believe him on the themes of this, but is that the case? Because those influences were in the Prime Minister's ear.
Well, what I believe, because I think we have independent corroborating evidence, is that a number of things went wrong. We locked down too late. Now, when it comes to who is responsible and the details of that, what I know of the facts, because of the areas I was involved in, his details are simply wrong. So he accused behavioural scientists of arguing that people wouldn't wear it, that people would have pandemic fatigue, that people, unlike people in Asian countries, cultural and racist assumptions, just simply wouldn't wear it. Well, in fact, that's quite wrong. The question of behavioural fatigue, you can see from the minutes of SPI-B on the 12th of March, that we rejected the notion that we should slow down because of concerns about whether people would wear it. That was repeated in the minutes of SAGE on the 13th of March. A few days later, 600 behavioural scientists wrote to the Prime Minister saying we don't recognise this notion of behavioural fatigue.
Okay, well, our time is coming to a close. Rory Stewart, you just wanted to get in on a final point.
Yeah, I just wanted very quickly again. I think there is a bigger question, which is criticism and analysis. Right from the start of this, it's been very difficult to question any of this. I found this at the end of February, beginning of March. It was very difficult to ask very simple questions like, why are we doing different things to East Asia? Why are we not locking down our airports? We have to get better as a country at dealing with criticism. That's inside government, because we don't have challenge inside government. We have groupthink and everybody gets very optimistic. So it needs to happen inside government. We also need to get better outside government. I mean, this thing from Dominic Cummings is a really good opportunity for us to try to look seriously at what we do wrong in crises, instead of which this is becoming, as usual, an amazing kind of black and white fight between he says and they said. And we're never really getting to the core of this, which is that we're not good enough at challenging ourselves. We're not good enough at admitting when we get things wrong.
Well, thank you to all of you for your time, for trying to go through some of the nuances there with us this evening. One area in particular where Matt Hancock, the Health Secretary, faced a barrage of questions today was on the detail of Dominic Cummings' attack on the so-called shield around care homes that we were just talking about a little there in the early days of the pandemic. Central to his accusation is that the Health Secretary promised that all patients with COVID would be tested before being discharged from hospitals back into care homes. Mr Hancock was forced to defend his record today. Lewis Goodall was watching. He's at our Newsnight wall to take us through the detail.
Yesterday, Dominic Cummings said this.
Now, all the government rhetoric was we put a shield around care homes and blah, blah, blah. It was complete nonsense. Quite the opposite of putting a shield around them. We sent people with COVID back to the care homes.
Today, Matt Hancock said this.
My recollection of events is that I committed to delivering that testing for people going from hospital into care homes when we could do it. I then went away and built the testing capacity for all sorts of reasons and all sorts of uses, including this one, and then delivered on the commitment that I made.
There is therefore now a crucial difference in the public record about an issue of vital importance. Cummings says that he and the PM were given assurances that discharged COVID patients would be tested before discharge to care. If this was a miscommunication or misunderstanding, it was a potentially catastrophic one. A reminder of what actually happened. On the 17th of March 2020, NHS England and NHS Improvement sent this letter, wrote to Trust telling them to expand critical care capacity to the maximum, i.e. by freeing up as many beds as possible. This included discharging patients into social care settings without tests. On the 2nd of April, NHS England reiterated this in this discharge policy and said that negative tests are not required prior to transfers/admissions into the care home. This was an active policy choice. Now, it wasn't until the 16th of April that new guidance instructing testing to go ahead on all patients was issued. Sometimes testing would have happened, but it was patchy and piecemeal. Now, Mr Hancock says the testing capacity just wasn't there. But looking back at that time, the UK was conducting around 1,600 tests a day by mid-March and about 10,000 tests a day by the end of March. There were about 25,000 patients discharged into care homes, so it isn't inconceivable that many, if not most, could have been tested with some planning and delays. And even if it was impossible, the question must surely now be asked: how was the decision taken to sign off on such an action when the consequences were so potentially lethal? And how does it align with this?
Right from the start, we've tried to throw a protective ring around our care homes.
What's also potentially mystifying, of course, is that we already knew from Italy how damaging this disease could be when it got into care homes, and yet the decision was made regardless. And remember the consequences, how appalling this period was in care homes. Take a look at this graph. We've seen it before. It's horrible to see it again. But these were the excess death figures for care homes in the first wave of the pandemic. Look how high that line gets up to in March, April, May. About 26,500 excess deaths in the care sector in the first wave alone. Even by the second wave, we note that we were still seeing some. Again, where was the protective ring? It certainly wasn't on display with PPE. Mr Hancock claimed today that he's always been straight with the public. Well, let's consider that. On PPE, he once claimed that there was never a national shortage. But take a look at this graph. In some ways, it really wasn't the case. This graph shows the stocks of crucial PPE items in the first months of last year. You see there in different items, aprons, gloves, eye protection and so on. It goes down in nearly all of them. By the time you get to April, you can't even really see the graph because most of it had already disappeared. Now, the National Audit Office said that NHS trusts broadly had what they needed. That's what Mr Hancock says he was referring to. But many workers on the front line said that they didn't have what they needed. And specifically on social care, the National Audit Office has said that the sector received approximately 331 million items of PPE from central government between March and July. Well, that sounds like a lot, but then remember this, that they said that only equated to 10% of the sector's estimated need from March to July. Compare that with 80% for NHS trusts. They got 80% of what they needed social care, only 10% from central government. These were all problems that we reported at the time, as did others. It isn't just about hindsight, as ministers now say.
I don't think that they can say it's mostly hindsight. And I think, you know, that there is clearly a lot of evidence that shows that, you know, that people were challenging this at the time. But more importantly, you know, this was a group of the population that before COVID came to this country, that everybody knew was the most likely to be vulnerable to this infection. And therefore, it's the group that the most should have been done to support it.
Of course, no one denies how difficult this situation was. Governments in the UK itself and around the world made mistakes. But what many families of the dead desperately desire now is a straightforward account of what happened in each of the key areas. That, without it, they say that their grief is made still worse. Often it is that sort of unvarnished account from ministers, if not from Mr Cummings, which remains unforthcoming.
Dominic Cummings' testimony yesterday suggested that there was no plan in place, and that was why it was delayed by a week, 10 days. That time period was when my father caught COVID in the community, and had the lockdown occurred a week or so earlier, he would be with us today. I think that the government at the moment is in denial. They don't want to acknowledge the mistakes that they've made. They don't want public scrutiny of the mistakes that they've made. And if they're unwilling to accept that they made mistakes, then how can they learn?